During the month at the Bergdorf Primary Care Clinic, I learned a lot of things, and one of those things was working with a team, a very diversified team of physicians, physician assistants, and nurses, social work. And together we were able to come up with comprehensive treatment plans for patients that, again, are very complex, and this is their last resort. So it's been really impactful as a human being and as a future primary care health provider. So one of the patients that came into our clinic had very high blood glucose readings and a uncontrolled diabetes. Diabetes is a condition that really affects the whole body and causes damage throughout it. The major damages that we hear about is nerve damage, there is gastrointestinal symptoms, there's high blood pressure as well, and eye damage or diabetic retinopathy. So the patient was prescribed 2 insulins, and after we spoke to him, we found out that he was only taking his mealtime insulin and not taking his long-acting basal insulin. That was because he could not afford the medication, so that was one of the major reasons why his diabetes was so uncontrolled. One of the treatment plans that we came up with was as comprehensive and interprofessional. The whole medical team got together and came up with a few essential changes that we could make to his therapy. One of them was discontinuing medications that he didn't really need to take. These medications were causing side effects and interacting with medications that were useful to him. Another thing that we did was also adding an oral diabetes medication that was essential to his therapy. And ultimately, what we ended up doing about the insulin, we were able to find a coupon for a long-acting basal insulin, and we were able to give that to him, obviously at no charge, instead of paying $400. And that's what he had been doing this whole time. We trained him on how to use the syringes, because before he was using only pens, and the patient came out of the visit with a few small changes, but we were hoping to make a true impact to his life. So in just a couple of weeks, the patient was already feeling better. He was able to concentrate more at work. He was getting less headaches than what he used to get. He also was feeling less weak. And those were all benefits from the therapy. And ultimately, his fasting blood glucose showed a response to the therapy as well. Before, his readings were at about 300 milligrams per deciliter, and now he came in at slightly over than 100 milligrams per deciliter.